welcome everyone to our speaker series, Semester in Detroit, um, with partnership with the General Baker Institute. Um, we want to welcome everyone here who is joining us live on YouTube, as well as the students who are in the Zoom room with us. We have a great panel tonight, full of wonderful speakers and activists and organizers. And so I'm going to, before we start, I want to make sure the folks that are on YouTube, you subscribe and hit the bell on the General Baker Institute's YouTube page so that you can get more events like this. And I'm Carolyn Baker. I'm with the General Baker Institute, and I am happy to be here. So tonight, this is Pandemic Politics from Lockdown to Liberation. And tonight's panel will be speaking about poverty, and we have a really good panel, and I don't want to hold us up too much longer. I'm not moderating tonight. Tonight we have the honor of having Shali Gupta-Barnes to moderate for us. And so I'm going to introduce Shali. Shali Gupta-Barnes is the policy director for the Kairos Center and the Poor People's Campaign, a national call for more revival. She has co-authored and edited 2 reports for the campaign: The Souls of Poor Folks, Auditing America, which came out in 2018, and The Poor People's Moral Budget, Everybody Has a Right to Live, which came out in 2019. Shali is also a board member with the General Baker Institute, and wanted to welcome Shali. Welcome, Shali.
Thank you, Carolyn and Craig and the Semester in Detroit series, program that's made this possible. Excited to be here tonight for this session on, sorry, one second.
What is this here?
No, sorry, honey. Sorry.
How's that, Dad? Where's Dad? Where'd Dad go?
Pandemic politics.
It's so refreshing to see that, Shali.
Child care and public health. Yeah, so anyhow, we're here as part of this series, the Pandemic Politics from Lockdown to Liberation series. And tonight, our session's called Economic Inequality and the Public Health. And I am honored to be facilitating this discussion with 3 amazing leaders, 3 amazing women who've been at the forefront of struggles around poverty and healthcare for years. One second. Okay. All right. And who we all just have so much to learn from. We'll hear from Valerie Jean Blakely from Michigan, from Nijmi Jarinko out of Pennsylvania, and Reverend Dr. Liz Theo-Harris from Wisconsin and New York. But before we get started, and I'll do fuller introductions of these amazing people that we'll be hearing from, I wanted actually to start us off with a video that that I'm not going to introduce, but I think just sets the right tone for our session today. So I'm going to share my screen.
Of people who were impacted physically. This song that we're about to learn is a song that's entitled "Somebody's Hurting My Brother." Now, this song was actually born in a town hall meeting around coal ash. And the meeting came about because Duke Energy was spilling coal ash into poor Black and brown and poor white neighborhoods. After hearing testimony after testimony of people who were impacted physically and mentally by the coal ash, this song came as an inspiration of those testimonies. So I'll call to you, somebody's hurting my brother, and it's gone on, and your response is far too long. Yes, it's gone on.
Far too long.
It's gone on.
Far too long.
Somebody's hurting my brother, and it's gone on.
Far too long.
Now the end is, and we won't be silent anymore. We'll say that together.
And we won't be silent anymore.
Okay? And so we'll try the rehearsal version, which goes. Oh, somebody's hurting my brother, and it's gone on far too long. Yes, it's gone on far too long. I tell you, it's gone on far too long. Oh, somebody's hurting my brother, and it's gone on far too long. Together, and we won't be silent anymore. Now we're gonna put a little rhythm to this, okay? Okay? We're gonna speed it up just a little bit. Not too fast. Oh, somebody's hurting my brother, and it's gone on far too long. Yes, it's gone on far too long. Tell you it's gone on far too long. Oh, somebody's hurting my brother, and it's gone on far too long. And we won't be silent anymore. Somebody's hurting my sister, and it's gone on far too long. Yes, it's gone on far too long. Tell you it's gone on far too long. Somebody's hurting my sister, and it's gone on far too long. And we won't be silent anymore. Did you hear somebody's poisoning the water, and it's gone on far too long. Yeah, gone on far too long. Tell you it's gone on far too long. Somebody's poisoning the water, and it's gone on far too long. And we won't be silent anymore. Have you heard somebody wants to build that wall, y'all, and it's gone on far too long. And we won't be silent anymore. And we won't be silent anymore. And we won't be silent anymore. Touch your voice and start clapping. And we won't. And we won't be silent anymore. Last part, all together. And we won't be silent
So just want to take a second to take in what we were hearing there.
We've been talking about the candid conversation Prince Harry and Meghan had with Oprah last night, including.
All right. Sorry, everybody. Just take a minute to hear the story behind that song, where that came from, how this coal ash, what comes out of, fossil fuel, our fossil fuel infrastructure, was being dumped in poor communities, was poisoning water, their land, that was having severe health impacts. And it just seems appropriate, as we talk about public health and economic inequality tonight, how it is that we can live in the wealthiest country in the world and have experienced over 20% of the deaths in this pandemic. How people still don't have secure access to water or housing or healthcare. And actually how our failure to address these multiple crises means we cannot even think of having any public health measures in place. In fact, the latest COVID relief bill, the American Rescue Plan, which was passed today, and makes some gains, it still doesn't actually secure our right to any of these basic things. And so all of our speakers tonight are part of the Poor People's Campaign. We have Valerie Jean Blakely, a leader in the Michigan Poor People's Campaign, the Michigan Welfare Rights Organization, the Michigan Coalition for Human Rights, who's currently an affordable water organizer and advocate with the People's Water Board Coalition. She's a true water warrior and proud mother of 5 children and 3 beautiful grandchildren. And then we have Nijmi Zurinko, a powerful Indigenous and Black leader in Pennsylvania, from a leader in the Pennsylvania Poor People's Campaign, a co-founder of Put People First Pennsylvania and the Nonviolent Medicaid Army, and a long-term organizer for healthcare and education and more. And we also have Reverend Dr. Liz Theoharis, national co-chair of the Poor People's Campaign, director of the Kairos Center, an ordained Presbyterian minister and biblical scholar, and welfare rights and homeless organizer for over 20 years. Now, there is, again, just so much to learn from these women on this intersection of poverty and healthcare and the inequalities that keep us as a country from being able to provide for the health of us all. But I wanted to start tonight with you, Valerie, as our first speaker. Water has been, and continues to be a public health issue in this pandemic. Washing hands became one of the primary public health measures that had to be taken to prevent the spread of COVID-19. But just in the city of Detroit, there have been over 100,000 shutoffs before the pandemic. Valerie Jean, I know your family has experienced these shutoffs, your entire community has. Michigan did have a moratorium in place. I believe Detroit still has one on these shutoffs. I wanted to ask if you'd share with us what has changed kind of through this pandemic, through these policies, and with people's access to water, and how has that shaped the public health conditions and response in Detroit and in Michigan?
First, I want to say thank you for inviting me to be able to talk on this panel with these amazing women. Truly an honor. Thank you. I mean, my story really kind of starts in 2013, 2014. We got word that DWSD was going to shut off water in mass, 30,000 households right away, and it turned out to be a lot more. So it was like, when we first heard it, we couldn't fathom it, but we started organizing against it. Organizations on the ground all around started organizing against it. In March of 2014, we learned that they were going to be they had hired a company, Hamrick, to shut off whole neighborhoods at a time because it was economically feasible for them. It was good for them, to be able to just shut off everybody at one time, take a whole list of addresses and shut them off. Hamrick is a demo company. It was hired by Detroit Mayor Mike Duggan. They were hired to execute the shutoffs because DWSD didn't have the infrastructure to shut off so many people at one time. So millions. It was $6 million in the beginning, and now we're like, $16 million in or something to Hamrick for them to shut people's water off. Hamrick, as they were shutting people's water off because they were a demolition company, wrecked the infrastructure. They used a sledgehammer to turn people off. We'll get back to that later on what's happening now, because people aren't getting turned on now because of that. So we'll get back to that later. In July, they came to my neighborhood. My family knew that we were in jeopardy of getting our water shut off. We had went through a terrible winter with our first polar vortexes in Michigan, and our pipes had froze and stuff. And the only thing they got paid was, for my entire neighborhood, was their heating bills. That's all you could afford. And they were astronomical at the time. Plus people's pipes burst and things like that. It takes months to recover when you're poor from stuff like that. So in July, when they came, we knew they were coming to our house. It was early in the morning. I've got 5 kids, so I get up early. Get coffee or whatever. And I heard something outside my house. I looked outside. It was a Hamrick truck. They were getting ready to shut me off. I grabbed my phone and my camera, and I just very quickly went outside and stood over my water access point. It wasn't anything. They didn't respond. It wasn't. I wasn't worried about them hurting me. I was a little worried about the police being called, but it didn't happen. And I just told them, you can't shut my water off. My kids are in the house, you know, and then I watched them systematically go to each one of my neighbors and shut them off. Like, just everybody got shut off. The resistance started immediately. We shut down the people, organizations, and people who lived in Detroit immediately started organizing, clergy, everyone, to shut down the Hamrick corporation where they were in Detroit. So immediate resistance started to happen. We set up a water station. We had a large march. We set up community teams to respond to such an atrocity. In October, the UN, the Michigan Welfare Rights Organization, wrote over and over and over again for months. Finally, in October, the UN rapporteurs came in to Detroit, and you know, they pretty much said that Duggan was in violation of international human rights to water, and they wrote a scathing press release. And they delivered it, and they delivered some sort of paperwork to President Obama at the time, who throughout the entire thing remained silent. Let me just say, completely silent. What was fought for and what's changed, right? Governor Whitmer signed legislation in March 2020 to stop residential water shutoffs for non-payment until March 31st, 2021. So all of Michigan is not going to be protected after March 31st, 2021, which to me is unfathomable and extremely egregious and mean and cruel. But that's the way it is. And Mayor Duggan decides in December 2020, even after ignoring a mass hepatitis breakout in Detroit, completely ignoring it, finally, and ignoring the pandemic up until December 2020, he decides he will authorize, after so much pressure, he will authorize a 2-year moratorium on water shutoffs until 2022. It's not enough, because people who can't pay, that means their stuff is just stacking up. So at the end of that, they're going to have like astronomical bills that they won't be able to pay, and they'll get shut off anyway. So it's unacceptable. Again, cruel, mean, and wrong. So Hamrick ruined the infrastructure. So because of this, so we got these moratoriums, right? So we realized as soon as Whitmer signs the moratorium that not everybody's going to get turned back on, right? Because Hamrick, a demolition company, was hired, and when they were shutting off people's water, they ruined the infrastructure. They used a sledgehammer to shut it off. And anybody who couldn't, and that's not it, right? That's not all. Right now, we're delivering water to folks daily with that because they couldn't afford to get pipes fixed and things last winter, and they burst, and they still have yet to be able to fix them. They can't get their water turned back on, even with the moratorium. And there's no programs in place that are fixing this. We've been fighting for it. There's like, you know, all these people saying we're going to fight to, or we're going to, you know, or all these organizations, higher up organizations saying that they're going to do something about it, and they're not. And people are suffering dearly because of it. And this is the last thing I'll say. Hopefully my 7 minutes isn't up. I was delivering water to a mother with children who couldn't get her pipes fixed, so she doesn't have water, and she's worried about her children being taken. So we like literally deliver water secretly in the middle of the night, real late at night to her. And she looked at me and she was crying and crying. She's like, I just want to get this fixed. I just need to get my pipes fixed, but I can't seem to come up with funds to do it. And she said, why don't we matter? Why don't me and my kids matter? That's what I ask. Why doesn't she and her kids matter? Why, as a society, we aren't rushing to her aid to get her what she needs? So that's the system we're in. And that's my story. Thank you for letting me tell it. Thank you.
Thank you, Valerie Jean. I think this is the question raised in this conversation is why doesn't that family, that woman and her children, all these communities across Detroit and Michigan and the country, over 140 million people, why don't we matter? As far as I know, there hasn't been a national moratorium on water shutoffs throughout this entire pandemic.
No, there has
Let
no.
alone a national guarantee that people will have access to water in the pandemic. And I just want to lift up what you said, that shutting people's water off was a multi-million-dollar business that people benefit from, and there are steep consequences to that. So let's continue now to Nizhmi Zhirinko from Pennsylvania, leader in the Pennsylvania Poor People's Campaign and Put People First Pennsylvania, which has been organizing around the right to health care for several years, and focusing especially on the rights of poor people to have guaranteed health care, including through the expansion of Medicaid, and the organizing around the nonviolent Medicaid Army, which is explicitly asserting that poor people have a human right to health care. Nizhmi, thank you for being here tonight and part of this conversation. I wanted to ask a similar question that Valerie Jean spoke to, in terms of what did this organizing around healthcare as a human right look like before the pandemic, and how has it changed through it in your work in Pennsylvania?
Thanks, Shelly. Yeah, and thanks for having me. It's good to be here. Thanks to General Baker Institute and this series of conversations. Yeah, I mean, I want to pick up with what Valerie was talking about and the really, really powerful struggle for the right to water. You know, MLK said, in a world that's 2/3 water, why are we paying water bills? That's still very relevant today. And, you know, here in Pennsylvania, actually, you know, very much inspired by the water struggle in Detroit and Flint, we actually had a situation in the pandemic where one of our committees, we have a statewide organization called Put People First Pennsylvania. We have 10 committees across the state, and one of them in Lancaster, Pennsylvania, actually fought and successfully got the city to halt water shutoffs to renters during the pandemic. So that's, you know, a way that our struggles connect. The water struggle is throughout the country. Water shutoffs are really a weapon against the poor and dispossessed and the working class. And it's also so very connected to health, right? The water is necessary to maintain health. So it's very much a part of healthcare rights. So in terms of organizing with the nonviolent Medicaid Army, first of all, that concept really draws inspiration from the original Poor People's Campaign and what Dr. King talks about as the nonviolent army of the poor. And it really is this acknowledgement or understanding that folks who are on or excluded from Medicaid are really under attack from every vantage point of the working class. So it's not just about folks not having health care, it's also housing, it's jobs, it's water, it's food. So if you are on or excluded from Medicaid, you actually have a window into all of those issues and also how they're all connected. They're not separate things. And so the Nonviolent Medicaid Army is a way of thinking and organizing ourselves to try to build permanent organization and permanently organized communities, because these are not isolated attacks. They're not just about single issues. They're the reflection of the fact that, you know, to your question, Valerie, you know, it's like, why don't we matter? It's like, we don't matter because we don't control our destiny as the working class. We are not in power. We do not have the power to guarantee ourselves of these rights. And so this is the essential problem. So we need organization over a long term and building power over a long term in many, many places across every state, across geography, across urban and rural and suburban and small town areas, across different kinds of people, different backgrounds, races, ethnicities, to really be able to elevate the consciousness to understand, you know, what is the root of these problems and how do we actually approach this so that we can guarantee these rights. I think your point, Shally, is very well taken, that even in this stimulus package, even in what just passed, you know, there's tweaks that have been made. There's certain benefits that have been extended, and there's kind of like this kicking the can down the road, so to speak. But it isn't actually fundamentally guaranteeing our rights. It's not guaranteeing our right to healthcare, to housing, any of those things. And so I think that's worth noting, because it shows very much that our class is not in power. The Nonviolent Medicaid Army, before the pandemic, was, you know, organizing what we think of as the leading social force. It's not that it's only restricted to people who are on or excluded from Medicaid. It's the understanding that people who are on or excluded from Medicaid really have a stake in really the transformation of society. And therefore, they, if they can be organized, right, like MLK said again, there are millions of poor people in this country with little or nothing to lose. If they can be helped to take action together, they will do so with a freedom and a power that will be a new and unsettling force in our complacent national life. So if we can organize the Nonviolent Medicaid Army to take action together, that can, you know, disrupt and unsettle the structures actually of society. And that is something that's in the best interests of everyone, right? Even the folks who maybe have not considered themselves to be poor, to be working class, but are rapidly finding that in the course of the pandemic, the economic crisis, the housing crisis, that actually not having our rights to any fundamental needs guaranteed means that all of us are at risk. All of us are at risk at any time of losing everything that we actually think we have. And so it's really organizing that leading social force on behalf of the whole society. And so healthcare has been, for us, a very uniting issue. We have a really challenging task of building power across, like we said, across the state, you know, across communities that have been historically separated from each other, that have been oppressed and exploited in different ways. So to bring us together, it takes a lot of very careful work, and it certainly takes issues that touch everyone's life in different ways, but that everyone can understand and relate to, and healthcare is such an issue. So organizing the Nonviolent Medicaid Army has been, you know, before the pandemic, healthcare was a serious issue. For example, here in Pennsylvania, in our Medicaid program, there's a very basic dental benefit, but those benefits were cut drastically in 2011, so that if you need deep cleanings, if you need root canals, it is not covered by Medicaid. Therefore, if you have those issues, you're getting your teeth pulled, or you're getting more serious diseases. We have a member who needs deep cleanings, didn't get them because she couldn't afford it and it wasn't covered by Medicaid. Now she has advanced periodontal disease. That has implications for the rest of your health. So this was already happening before the pandemic. And then in the pandemic, you know, we saw that the rollout of the vaccination has been completely haphazard. The vaccination itself has been a source of profiteering. And it is illustrated that we do not have a functioning system to actually meet people's needs. It's very clear in the way that the vaccine distribution has happened. And this is directly resulted in death, in the death of over 500,000 people and death in an ongoing way. And so the pandemic has really, made it come to light, but it also is necessary to continue to bring it to light, to continue to talk about it, to continue to frame it, to continue to tell that story so that we don't just get lulled into a sense of complacency, like this is the way that it is, which is unfortunately very much how we get conditioned in this society, is to accept these outrageous things as just a part of normal life. And I think the pandemic has accelerated greatly the work, the organizing that we're doing here in Pennsylvania. It's brought a lot of people toward us. Over the last year, the Medicaid enrollment went from 1.4 million to almost 1.7 million. So it's increased by almost 10% in a year, because now, more and more people actually need it. People are losing their employment. They're losing their employer-sponsored coverage. So they're signing up for Medicaid, which makes the struggle around Medicaid a really critical one. And again, it's not just about the struggle for Medicaid. It's a struggle to organize and unite our class over the long term in order to make real transformational change in society.
Thank you, Nijmi, for opening this up, right? I mean, we're talking about public health and poverty, but we're talking about, when we look closely at what that means water, it means healthcare, it means housing, it means food, it means all of these things. And so clearly, poor and dispossessed people in this country experience all of the lack of these basic needs, and therefore the possibility of fighting for all of them. And as you said, not just to transform the whole country. This question, you also raised this point about, and I just want us to hear this again, that not having our rights guaranteed, not having the rights of poor people guaranteed through this pandemic made it so clear that all of us are at risk. And I think you're pointing here to this, to a fundamental change in our economic model, to, rather than waiting for wealth to trickle down from the wealthy, we have to lift from the bottom. Rather than, working from a position of scarcity and having to cut up small pieces of the abundant wealth in this country to a few people, let's actually take that abundance and share it with the people, with everybody, beginning with the people who need it the most, not the ones who need it the least. One of the things I've been thinking about is how in 2017, these tax cuts were passed that gave trillions of dollars back to millionaires and billionaires who didn't need it. And we've had to fight so hard to get some percentage of that kind of relief in a moment when millions of people need it. And there's this fundamental gap in our moral response that reflects just a whole set of values that must be changed. This revolution of values that King and others talk about. So Reverend Liz, as the co-chair of the Poor People's Campaign, the national co-chair of the Poor People's Campaign, as the director of the Cairo Center, and a religious leader who's been organizing around poverty and inequality and healthcare and more, I wanted to ask if you might talk some about this moral and ethical fight that we're in, and how it is that a country that can have such abundance, that can have such wealth and resources, hoards that, really doesn't make it available to more than 40% of the country, and what that says about our fundamental values, and how we can hope and organize to change that, beginning maybe with even, Valerie Jean raised this concept of, how even if we get this relief, even if the water shut off, we're going to be strapped with, millions of dollars in debt that's still going to be paid. There's medical debt mounting. There's housing debt mounting. There's been no debt relief at all, meaningful debt relief that can actually carry us, from even this $1.9 trillion to a place of basic economic security. So wondering if you can speak to some of these questions and perhaps share more also about the Poor People's Campaign and its basic mission.
Great, thanks so much. It's really good to be with everyone this evening. I have a great love of Michigan. My mom grew up in Highland Park, and my mentors in the organizing work are Marion Kramer and General Baker and Maureen Taylor. And so both my political genealogy and my biological genealogy really has its roots in Detroit and in the struggles of people across the state of Michigan. So, and yeah, I really appreciate the conversation so far, the powerful stories and analysis of both Valerie Jean and Nishmi. And I agree that somewhere where the conversation is going is to the concept of we talk about in the Poor People's Campaign that we're not just trying to curse the dark. We're not just trying to point out everything that's wrong, but we're trying to shine a light on what's possible and necessary. So when the Poor People's Campaign launched, we launched with the most expansive and largest wave of nonviolent civil disobedience in the 21st century. But organizing, not just, again, cursing the darkness, not just organizing against, but holding forth that another world, another way of doing things is possible, and really pushing back against this distorted moral narrative that tells us the story, that feeds us the lie that it's poor people and people of color and immigrants and queer people and women who are to blame for all of society's problems. A narrative that pits us against each other, having us fight in our silos and also fight against each other along all of these historic lines of division in this country. But then also that feeds us, this untruth of this is as good as it gets, that we're living in scarcity, that we can't hope for anything better, that we should just be really pleased when we get even some crumbs or even a stimulus package for the tune of $1.9 trillion. But what we really hold up in the Poor People's Campaign, and this comes out of the struggles and out of the solutions of some of the 140 million people in this country and billions of people across the world who are poor and low income and want emergency from desperate economic ruin. That indeed, when you organize society from the bottom, when you I'm a biblical scholar as well as an activist and a mom, and as it says in the Bible, when you kind of forgive debts, when you undo unjust structures that lead to slavery and dispossession, when you pay your workers what they deserve and what they need, and when you give out money knowing you'll never see it again, but that it's an investment in the larger society, that this is how you'll build up society from the bottom up. And so, this is really the concept of Jubilee. If people have heard of the biblical notion of Jubilee, I mean, it's debt relief, but then a whole lot more. And it's what we actually in the Poor People's Campaign called the legislative platform that we unveiled this past summer and that we're still organizing power around. And the very idea there is both, you can't address one of these issues without addressing all of them, that they're interconnected. But also that where you have to start is, in the needs and demands of those who are most impacted by poverty and inequality. In the words of Frederick Douglass, those who would be free must strike the first blow. Those in pain know when their pain is released, right? So this idea that movements, that moral movements, that ground up movements start with those who are most impacted, those whose backs are against the wall and all we can do is push, that those who are compelled to come together and organize against oppression, against racism, against structural injustice, against poverty, indeed build and lead strong, powerful movements. And those movements, have to come from the bottom up, but then end up being built in a way that it involves everybody, right? And insists on certain truths, certain principles. One surely is, as Shally was talking about, and as Niju was connecting, that that if anybody is without, then everybody is at risk of being without, right? Again, another kind of biblical story that's connected to this is from the New Testament, where people might be familiar with the idea that what you do to the least of these, I was hungry and you gave me food. I was thirsty and you gave me something to drink. I was in prison and you came and tore me out. I was and this idea that this isn't just charity. This isn't just like we're going to do one by one by one. But that actually, that every human being that ends up in a position of precarity, of oppression, of insecurity, of despair, means that any person can end up in that predicament, because we are structured as a society to produce. This is a death-dealing, poverty-producing system. So that's one principle. And once we kind of understand that that's the case, that poverty is not an accident, but it's actually structured into the very core of our society, then there are other principles that really follow from it. And that is, one is that everybody has to be in, nobody can be out. There's no line between those are deserving and undeserving, right? Right now we're talking a lot about reducing child poverty. And there's a number of things about that conversation that are walking a fine line. One is it separates child poverty from the poverty of whole entire families, of parents, of caregivers, right? And the idea that a child should not be poor, but it's okay to pay their parents a sub-minimum wage, that it's okay to have their parents cut off of water, it's okay for their parents to not have the dental care that they need. It reifies the idea that people are to blame, not that society is structured in this way. Also connected to this is this very notion of reducing and not ending, right? The idea, for instance, right now we're talking about, whether this new child tax credit, and I don't know how much people are following the news, but the idea is that, somewhere between 7% and 45% of children are their poverty is being relieved. But even if we go with the highest number of that, even if this infusion of money, of temporary money, lifts for a limited time, 50%, half of children who are living below the poverty line up, it still leaves 50% of children in poverty. And so I remember the words of a homeless mom that I was organizing with back in the 1990s, who would talk about cutting poverty in half. And she said, I have 2 children. Which one of my kids am I going to leave in poverty? When you set it up that way, you set it up for failure. And so I think that's another principle of what kind of everybody in, nobody out is. And of this whole idea of Jubilee, of radical redistribution of political and economic power, of building and lifting from the bottom so that everybody can rise, and of having a healthcare system, water and sanitation system, employment system, a school system, that all are actually about lifting people up and letting people be able to live to their fullest potential. The idea of some of the conversations we're having around health, what we have heard from the public health experts in supportive of our work is that 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 pandemics like the one that we're living in spread on the fissures that already exist in society. So if you have racism, if you have poverty, if you have inequality, it means that a public health crisis only gets worse, right? Which means that you can't just put a Band-Aid on the wound of a public health crisis. You have to, change the whole system that allowed that wound to get as deep as it is. And so, I think that that's what it means to then be building a movement from the bottom up. But that's what it also means to be holding out these bold and visionary demands that say it does not have to be this way. This is not as good as it gets, and that those who would be free are organizing and protesting and building a movement that can actually right the wrongs and transform society in visionary and hopeful ways.
Thank you, Reverend Liz, for that reminder that we need now and always, that half is not enough, everybody in, nobody out, and that while we celebrate the gains that are made, we can never forget how far we must go to fully live into the principles of Jubilee and what is both necessary and possible in this nation. So we will open up for questions in a few minutes, but I wanted to open it up to the whole panel to share a little bit on kind of the possibilities that you see around organizing right now. Maybe concretely, what are some of the openings that are being created? Some of the even amidst this terrible crisis, that yes, there will be some relief. What are some of the openings that you see happening right now that spur and develop and encourage and give life and movement to the organizations in power that we so desperately need to be building? And this can be on any and all the fronts of struggle that you all are involved in, but I'd open it up to all three of you, Valerie Jean, Nijmi, and Reverend Liz, to speak to that.
Well, here in Detroit, folks are, they're organizing the best way that they can. Of course, we're all on Zoom. But we're also doing phone campaigns and just stalking our people, or stalking like the governor to shut down Line 5 so that the Great Lakes is safe and clean and things like that. And also about the water shutoffs, like asking her to extend the Michigan. I'm really we're demanding her to extend it. People are still meeting in the streets and organizing, and there's I think a lot of organizations are really trying to figure out what to do next, how to do it, how we can manage it safely. We all feel like we're in the realm of kind of recreating what we do and what we did and how we organize it. And that's an interesting thing. It's good and bad in a lot of ways. Like, you want to be able to reach people. You got to go door to door, all of these things. And you have to rethink that. You have to understand that. So everybody's really, I feel like, here in the midst of trying to understand that. But also we're doing lots of stuff to just harass the people that we need to do the things that we need them to do. And we're also rethinking, like, upseating the entire city council with our folks, right? Putting together campaigns like that. Certainly getting rid of our mayor, who absolutely hates Black people, hates Black people. Steadily, everything that he does removes them. So we're always fighting against that. But yeah, I think we're rethinking things and trying to figure it out as we go. It's going to be interesting to see what we come up with.
Yeah, for sure. That reminds me of General Baker saying that there are three three fronts of the struggle: the streets, the legislature, and the courts. And sounds like you're hitting all of them, Valerie Jean.
Sure, I could just say that I think in terms of openings, we're emerging from a period of even greater isolation than we normally even experience in the society. And, our organization, I think the way that we see things is that organization is a source of strength, organization is power, but it's also a source of connectedness. And so there's a really important opening to help people break their isolation through getting connected in real ways with real relationships, not simply, running people through sets of tasks, faster and faster, but actually building real relationships and that last in an ongoing way. I think that there's an opening for projects of survival right now in a major way. And when I say that, what I mean are things that build, for instance, on the legacy of the Black Panthers free breakfast programs and free health clinics that were designed to help meet people's needs, but also organize them, not to take ourselves out of society or suggest that we can take over the functions of the state, but actually in the service of building a movement to challenge the state and to transform the whole society. And so projects of survival are, for instance, here in Pennsylvania, we're signing people up for Medicaid and other benefits in places like food banks, in places where people are going to meet their needs. And then we're connecting with them and having organizing conversations and inviting them to become involved in our work. So I think there's a huge opening around that right now to, connect with people where they're meeting their needs and actually start to organize from that place. So I think those are two pretty major openings right now.
Yeah, I mean, I think the thoughts I have are pretty connected to both what Nijmi and Valerie Jean have said. I've been doing this work for a very long time, and have seen various administrations and various policies kind of come and go in that time. And there's something about this moment. I'm the director of something called the Kairos Center. And the Kairos Center is one of the anchoring organizations of the Poor People's Campaign. And Kairos is a Greek word. It means, it's a concept of time, but not linear time. It's kind of like it's when the old and unjust systems and structures are breaking down and something new has the potential to be born. It's an opportune time. It's a moment when of crisis, but crisis that also means that something better and more transformational is on the horizon. And I really believe that this is a time like that. When I think about where we were 5 years ago, just talking about the idea of building a Poor People's Campaign, and most media folks and Shirley funders, but then also, many poor people and lots of scholars just kind of poo-pooed the idea and said, well, poor people can't organize. And folks said, the poor are going to always be with you. And folks said, well, the most you can ask for is, kind of good charity. And haven't you seen what's happened when people have tried to organize from below across all these lines that divide? Dr. King was killed, Fred Hampton was killed, all of this. And then to see actually, the growth of powerful movements, plural, right? Whether it's seen in the kind of uprisings this summer where in thousands and thousands of communities, people said it's not okay to be killing Black young people, Black old people, Black men, Black women. and what we've seen in like West Virginia right now, and the height of this kind of debate around living wages is, you know, just so many community leaders come forward and say, you know, Joe Manchin, who is blocking so many progressive policies in the Senate, does not speak for us, the people of West Virginia, the people of Appalachia, or to have folks in Nebraska and Montana and Oklahoma and Colorado and places where I would have never imagined that revolutionary change from below could happen. Have folks coming forward and building powerful, efforts and campaigns and organizations from the bottom up. And so, you know, I think what this moment seems to be for me is one where there is great possibility, but it isn't automatic. It isn't that just because we're in the streets, then everything's going to be okay. It's not just because now we're talking about some issues, the pandemics of racism, poverty that existed before COVID, that now that we're more aware that it's going on, that it's going to just be resolved. It's not that, you know, it's enough to have, you know, some more people involved, but that you know what history says and what work today is showing is that that it takes, you know, leaders, folks like you all gathered in this class and in this work, and the leaders that build up the Poor People's Campaign every day, who, you know, who feel really, really, really deep about the issues and can see really, really, really far onto horizon of change. And anything less than that, you know, will not bring about a powerful movement for transformation and change.
Thank you. Thank you, everybody, for showing us just how big we have to believe that, you know, that how big we must start to, you know, expand beyond what we're told is possible, expand beyond what we're told is available, and start from the basic, you know, needs that aren't being met and say, well, let's meet these needs. And once we do that, you know, not only will we attract and bring in the people in all of these communities who are fighting and organizing and building these projects, but then also, as Nijmi was saying, shake awake, you know, awaken the sleeping giant, that, you know, to the injustices that that cannot go on anymore, because more and more people will not let them. So I wanted to, we have several questions that have come in the chat. And so I wanted to just share a couple of them, and then maybe our panelists can speak to the ones that speak to you. So one from Monica Isaac is more on this principle of everybody in and nobody out, and whether it's effective to speak to folks, to speak about a moral conscience as opposed to speaking to material conditions. There's another question about, there are a couple questions about that, this relationship between the moral conscience and material conditions, and how do you build around both of those together? And relatedly also, this kind of the vision of the revolutionary imagination. What exactly are we fighting for? What is that vision? What does it look like? And how do you make it real? And then there are other couple questions on, how do we push to make this politically possible? What is the 1.9 trillion the best that we can expect from the Democratic Party? And what does that mean for the work that we're doing? So maybe we can start there.
Well, as far as the last question, I don't think we should expect anything from the Democratic Party. Anything that we free us, we take care of us. The the mutual aid that's happening right now is like this heartfelt, like there's so many people like taking care of other people. Like all of us are like realizing we're in a moment where we have to take care of each other. So I don't think that we should reach out to either party for comfort or aid. It's just not going to happen. We free us, we take care of us. Can you say Monica Isaac's question again? Because it was kind of complex, and I really want to think about it, even if I can't answer it.
Yeah, and thank you for raising the point on mutual aid. This was another question about, are there really people who are placed in communities who are organizing these projects? How is that trust being built, and in what ways? And so we've heard around the water deliveries. I think we've heard other examples in other places, but thank you for raising that as well. Monica was asking, and other people have asked, this relationship between, appealing to the moral conscience, the moral necessity of these changes, as opposed to, talking about the material conditions that people are facing. So is it a moral question? Is it a material question? Is it both?
I'm personally going to have to break that down in my own head. But I appreciate her asking it, because I wouldn't have thought of doing that otherwise.
Yeah, I mean, I would say, I mean, I think it's for sure, at least in my experience, both, right? I mean, I think we have to hold out both the immorality of a system that throws out more food than it takes to feed everybody, and remind people that the real moral issues, what really is right and wrong, is how we treat each other, and whether we have healthcare and water that's free, whether we have jobs that pay a living wage and are actually about, bettering ourselves and humanity, and whether we really take care of everybody, right? And I think, and these are the moral issues of our day. And what is immoral is suggesting that people should pull themselves up by their bootstraps, or that trickle down will work, or that people are at fault and to blame for the experience of injustice and violence and the militarization of their communities. And I do think that there is something about appealing to people's moral conscience, that it does not have to be this way, and holding out the possibility for change. But I also think what we know about movements is that those who would be free must strike the first blow. And so that has something to do with, material conditions actually compelling people to get involved in the work of undoing unjust structures, right? That if indeed nearly half of the country is living in some form of poverty, and that at some point in 80% of people's lives will experience poverty, there has to be something also about not just goodwill, not just moral conscience, but actually people's kind of objective situations that they're living in, that also connects us. So there might be lots of differences of where we live, and what we like to eat, and what our kind of cultural traditions are, but also the fact that that we all wake up in the morning and need to be able to kind of provide for ourselves and our families, and have this aspiration of thriving, not just barely surviving. And so I think it has to be both. I think when you don't talk about what is moral and appeal to people's moral conscience, you risk letting others define what morality is, and you also risk making the tent too small, and have us saying only people that are homeless living on the streets can lead this movement, when we need everybody. But also when you only talk about moral conscience, you forget that there are folks who have little or nothing to lose, like Nijmi was quoting from Dr. King earlier, from the current status quo, and everything to gain from changing society. And that something like the abolitionist movement, you know, was a combination of calling out the immorality of a system of U.S. chattel slavery, but also the creative and powerful, compelling organizing of the enslaved and formerly enslaved, saying this is not okay, and so we're gonna, you know, we're gonna organize a movement to change all of this. And so my experience and study of history says that that you need both.
Thank you. I could speak a little bit to some of these questions. You know, I mean, I think something that has helped me a lot in my process as an organizer, which, you know, for the last 8 years, going on 9 years, I've just been doing as just part of my political work. I'm not a staffer. I'm not, you know, I'm not on staff of an organization or something like that. Just to speak to this question of like, how do we sustain these long-term organized communities of poor people? One of the things that's really helped me is to study, to learn with others. I know that that's one of the roles that the General Baker Institute plays, is helping us all, you know, understand history, you know, what do we come out of, what have other processes of change, social change look like in our own history and the history of people around the world. Because we're not, you know, we're not starting from today. We're not starting from this moment, right? It's not just about what's in our mind, what we can imagine. I think there's a lot of that kind of talk just in the world when people talk about changing society. There's so much about like our imagination, and I just want to speak to that because that was a comment that somebody made. And visioning is good and it's important, but also really understanding, you know, what are the conditions that we're in, you know, what are the methodologies that people have used to actually like throw out ruling classes from different places, you know, like how have they succeeded in that task at different points in history, and what can we learn from that today? And I think that the kind of vision that we're putting out here is not actually, you know, it's not based on, you know, a fantasy idea of reality. It's just based on, as you said, right, like a society that's organized around meeting people's fundamental needs, you know, meeting our human rights to housing and to water and to food and to education, and those basic things. And that, you know, I think that where we have a lack of imagination because we haven't really learned, and we haven't really studied, and we haven't really dived into these questions, is we have a lack of imagination around how could such a society and an economy be organized. But that's on, you know, that's not because it has never been, or it isn't even currently. It's just because that's not our experience, you know? And so we actually don't need to go into a world of like speculative fiction to imagine what that could be like. We actually have to look around the world. We have to study history, and we have to understand, you know, what makes it possible. What are the conditions and the, you know, the situations and the organizing potential that makes it possible to actually to win those things, you know? And I just think that that stuff is out there. We have to actually learn it. It's not about just envisioning or imagining it from today, starting from right now and kind of what's in our individual heads. I think we get very conditioned in this country around some, you know, habits as the working class, right? Like we're the most disorganized, we're the most disunited, we're the most distracted, we're the most divided. And that also manifests itself in how we sort of have this mental fortress around what change looks like, and not really recognizing that we have to learn a lot to be able to figure out where to go from here.
That's right, Nijmi. And I would add that one of the things we have to learn is a new way to understand economics, alongside everything else that you listed. We've, in the course of these debates around 15, around this package, there are all these, facts going around about how raising the minimum wage to 15 is going to destroy the economy. It's going to ruin jobs. It's going to, decimate small businesses. And none of that is actually true. Adding 15 into the economy will go right back in for, there's economic, economic study, plenty of studies that show that the impact of raising the minimum wage to 15 would be basically zero on jobs. In fact, it's just going to boost small businesses by spurring consumer demand and having more resources in the hands of people to keep things going. And there's so many instances like that we've seen, even recently, over the past year, how the unemployment insurance at $600 a week was maintaining millions of jobs in the economy. How it is possible, right? It is possible to stop shutting people's water off. It may not be possible to turn it back on, but it would be if there was an infrastructure plan to rebuild that infrastructure that was damaged, right? The solutions are there in the problem. And it doesn't take much to find them, but it takes a lot more to organize around them. And that's the power that's being built across the country. So we are coming to the close of our session tonight. And I wanted to just ask the folks on the panel to say how people can get involved with your organizations, with the National Poor People's Campaign. I can say, I can speak to that a little bit. The National Poor People's Campaign, we're organized across 45 states in the country. If you go to poorpeoplescampaign.org, there are, you could look up your state, reach out to that committee. If they don't respond, reach out to Carolyn or myself, and we'll put you in touch. And our main activity right now during the national campaign is to push around 14 policy priorities, some of them, that were partially addressed by this COVID relief bill. But we know that if we implemented these now, we could actually begin to provide for the public health. We could begin to provide and address these health inequities and poverty and lift this country up from the bottom. And every Monday, we have a program called Moral Mondays, that throughout these first 100 days. And these, where we hear from states across the country, leaders across the country, leaders like Nijmi and Valerie Jean and so many more who are taking these fights up on the ground in these 45 states. And this coming Monday, we'll be doing deliveries of these demands to state houses and governors in multiple states. So it'll be a very vibrant and exciting time as we, in some places literally nail our demands to the doors of these state houses and show that we are not, we are not just cursing the darkness, we are bringing the light and showing a way forward. Let's see, Nijmi and Valerie Jean, did you want to say anything more about your organizations and how people can get involved in Michigan or in Pennsylvania?
Certainly in Michigan, the peopleswaterboard.org. You can go there and like us on Facebook and follow us so that you can get all of the things that are coming out from them. And I mean, really, Detroit is a plethora of ways to get involved. So, and Michigan. So certainly reach out to me or anyone else. We the people of Detroit. There's a handful of ways to get involved. Flint Strong. There's a lot of ways. So yeah.
Great. Thanks. And I know that many people who are in the meeting are from Michigan, but if you're watching the stream and you are in Pennsylvania, you can get involved at putpeoplefirstpa.org. And we're also part of the Poor People's Campaign. So if you sign up for the National Poor People's Campaign, you'll get connected to the state campaign.
Thank you. And we actually have one more question, and maybe, you know, as a maybe your response to this question can kind of close out our panel before I turn it back over to Craig tonight. And it's a question about fear. You know, there's been so much ambiguity and insecurity and violence in people's lives, not just over the past year, but for many years. But you know, there's a fear of future pandemics, fear about financial instability, fear about low income and BIPOC communities having equal and equitable access, fear about false information, fear about, you know, not even learning the lessons of this pandemic. What do we do in the face of fear? And how do we move, you know, how do we acknowledge and feel that fear and face it, but then move through and out of it? So wondering if folks can answer the question as a way to kind of offer some closing remarks and wisdom from your experience.
So I'm happy to start, and others can go as well. So I mean, I think if we're not fearful, we're not paying attention to what is going on and what was going on even before this pandemic hit. I think all of the issues that are raised in this question are not just problems that might happen, that are currently going on. We have a unbelievable, unequitable distribution of the vaccine. And also because of how this pandemic has been addressed, these variants that may not be able to be controlled by the vaccine. Again, we were comfortable in this country with 700 people dying every day because of poverty and inequality before the pandemic hit. And so going back to that, and especially the way that poverty and racism has really deepened and really spread over the course of this past year. And you know, it's again, we better you know, learn from that and do something about that, and not just build back better, but, you know, root that kind of injustice out and build society in a different way. I mean, I don't know if folks are familiar, but what we know as the "I Have a Dream" speech of Dr. King's actually had a different name. The title of that speech was "Normalcy Never Again." And I think it should actually be kind of a rallying call for our work every day, right? Just that, like, we can't, like, what is normal? Normal is, you know, 1,000 Black people being killed by the police every year. Normal is, you know, the communities that are hurt first and worst by climate change being poor communities and communities of color and Indigenous communities, and you know, we could keep on going. And so again, I think we, you know, I don't think that fear is the place that we organize from, but if we're compassionate, aware people, we should be taking this very seriously. But then I think, you know, I get some kind of comfort in, so for one, I don't think that you can, you know, build a more just world without actually, you know, analyzing and understanding the situation that we're living in. You know, what Dr. King says is an accurate prescription rests on an accurate diagnosis. And so again, I think we need to start with all of these questions and all of these concerns and all of these fears. But then also remember that again, as Dr. King says, only when it's darkest at night can you see the stars, or thinking about, some of the most powerful organizing and also agitating that went on in the abolitionist movement. I really encourage people in this kind of moment to go back and read Frederick Douglass's response to the Dred Scott case, where people were like, this is just about as bad as it gets. Where, I mean, it became very clear that there was no law, that there was basically no dignity or protection of the life of the enslaved, right? And so he said, well, let this, this ruling, and this deep fear that it brought, especially amongst those that were a part of the anti-slavery movement and were trying to figure out where to go from here. He said, well, let this embolden our agitation. Like, let this be, and again, what he reminds us, and then what we see in history is that it's actually after, something as terrible as Dred Scott, something as terrible as just policy upon policy, structure upon structure that is about oppression and the degrading and loss of human life, but that's where people are emboldened and where change kind of comes, right? And so again, we've learned from some folks in South Africa. They have this saying that they've passed on to us of that only a dying mule kicks the hardest, right? And that in fact that this kind of inequality and the kind of fear that comes with it is there because it's not inevitable, but because change is possible and on the horizon.
Thank you, Reverend Liz. Nijmi or Valerie Jean, did you have any final words for our session tonight?
As far as fear goes, some of the greatest things that have ever happened, we had to face our fears to do. Certainly on a daily basis with children and family and what's happening in the world. I got to face my fears to do them. We got to do them. This is a collective fear that we're all experiencing right now, not just because of COVID, but because of layers and layers and layers from poverty to racism to transphobia and the things that we're all dealing with. We have to do it and collectively do it in a way to where we're all going to benefit from it. Fear is apathy at this moment. Right? It's literally apathy at this moment, feeling for each other. We're at a moment where we have to take care of each other, and that's the goal. That's life goal at this moment. Yep. We got hard times ahead and we've got good times ahead. We just got to create them. Yeah.
Thank you, Valerie Jean. Thank you, Nijmi. Thank you, Reverend Liz. Thank you to GBI and Wayne State and University of Michigan for the Semester in Detroit class and session today. And, I will now turn it back over to you, Craig.
Thank you, Shaylee. This was a powerful evening. I'm humbled by what I listened to, the grace and the wisdom. And I want to thank all the speakers and Shaylee for moderating in two ways and for two things. One, for modeling being powerful activists in this world and modeling that for all of us. And secondly, for reminding us and underlining that poor and dispossessed and oppressed working class people have been organizing for a very long time, continue to, and that, as General Baker, I think, reminds us and told us many times that victory is in the fight itself. And I think it's more than just a catchy slogan. There's a lot of real depth to that idea. And I think the examples you shared were powerful and really important for us. So thank you again. I just want to point our attention before I hand it over to Carolyn, who reminded me that after we stop, we're going to have a bit of a pregnant pause, so to speak. We'll ask our speakers to stick around for a few minutes as the YouTube channel kind of has a little bit of a delay. But 2 weeks from tonight, reminding our students and our visitors on YouTube, we do not have our session next week. We have a break next week. 2 weeks from tonight, we have a powerful panel on housing and the right to live. Obviously, housing came up this evening in different ways. It certainly has come up in the series. We have Savina Martin from the National Union of the Homeless, who's going to be speaking in 2 weeks, and we have who Valerie obviously likes. I can see in the screen there. We also have a wonderful speaker from activists from United Community Housing Coalition in Detroit, who many of us know of, and also Detroit Eviction Defense. So different ways that activists in the city are pushing back and have been for a long time, around evictions, foreclosures, and the housing crisis. And so that's in 2 weeks. Please come back. Again, thank you, speakers. Thank you, GBI. Thank you, Wayne State. And thank you to my employer, U of M, for paying a little bit of our way here as well. Thank you, everybody. Have a great evening. And if the speakers could stick around just for a minute.
We're clear.